Welcome back to Face It with Dr. G. I'm Dr. G and I am solo today. Excited to talk to you guys and really excited to launch and continue to have guests on the podcast. We had our amazing first guest last week. I can't even keep track of time. Jessica Christie, a PA out of Michigan, and she is incredible. We had a very unfiltered, raw, real conversation about some hot topics in aesthetics. So listen to that. And we have a whole list of really incredible people that will be on this podcast. And it won't be just providers and in the aesthetic industry. It'll be a mix of really amazing people and conversations. And I'm excited. But all you guys meet today. So we're going to talk about the natural fillers and what is this and why is everyone talking about it? Actually, I think hardly anyone's talking about it and more people need to be talking about it. So I wanted to hone in on, the shift really in aesthetics. And we are shifting more to our body rejuvenating and regenerating itself. And who doesn't want that? There are pros and cons, way more pros than cons, but let's go through that. So specifically, when I talk about a quote unquote bioidentical filler, I'm talking about a product called Easy Gel. And this has been branded. It's called Easy Gel, but it's the only one available in the United States. And what happens with this process is that we take the blood, we spin it down in a centrifuge, and the concept is that you take everything you want from the blood and re-inject it into the face or the body to help stimulate cellular growth, proliferation, and then collagen and elastin production. And we can do two different things here. We have Easy Gel that I just mentioned, and we have platelet-rich fibrin. So let's talk about the differences. So Easy Gel, as I mentioned, let's talk about the similarities first. So for both of them, is required to draw your blood, and that is a rate-limiting step. If you can't get the patient's blood, or if there's a reason why the patient shouldn't have their blood drawn, they're significantly anemic or any other issues, they're not a candidate for this. So we draw the blood and we'll draw a certain number of tubes depending on the volume we think we'll need. Minimum is usually around 2 tubes. And we spin that blood in a centrifuge. And this is a specific centrifuge and specific blood collection tubes. And so with platelet-rich fibrin and with Easy Gel, we have nothing in the tubes. It is 100% natural, 100% your body. There's nothing in there. And the reason that's important is because platelet-rich plasma, which some of you may know is used in things like the vampire facial and other things, other injectables, PRP is not technically 100% natural. It is not 100% your body. It doesn't mean that's bad. It's just a fact. And the reason that it's not 100% natural is PRP has an anticoagulant in the tube. And what that does is, I'll explain that in a little bit later, but that anticoagulant is something like citrate or bovine thrombin, and it prevents the blood from clotting. So we'll get into why that's important later. Okay, so let's say we want to make platelet-rich fibrin, and we have taken the blood and we've spun it down in the centrifuge. There's a specific speed, RPMs, that we spin it at. And with platelet-rich fibrin, it's a slower speed than with platelet-rich plasma. And what that allows is selective isolation of the cells that we want. Versus with PRP, it's faster and you get a little bit more of a variety of cells. It's platelet-rich plasma. So plasma that's rich in platelets. With platelet-rich fibrin, it's fibrin that's rich in platelets. So it's plasma versus fibrin. And with PRF, you get that slower spin. You then collect the platelet-rich fibrin from the tubes when it's done spinning. And you can keep it cool if you want. If you need a little bit more time, you keep it cool. And that's able to be either directly applied to the skin or directly injected into an area. And the ultimate goal is that while it's there present in the body, you, through a series of events, through the clotting cascade, platelets are the cells in the blood that clot, they're part of the clotting cascade. Platelets have granules in them, and we're not going to get into the nitty gritty, but within those granules, there are growth factors. Several that we should know about are platelet-derived growth factor, PDGF, and fibroblast growth factor, FGF, and then vascular endothelial growth factor, so VEGF. And these are all released from the platelets once the platelet-rich fibrin is injected, and they stimulate the certain things to happen. So platelet-derived growth factor will stimulate fibroblast growth and proliferation. Fibroblasts then create collagen. Vascular endothelial growth factor, it's vascular endothelial. So endothelial cells are the cells that line the blood vessels. And so this growth factor stimulates blood vessel proliferation or neovascularization. So the blood flow that's created is helping nourish our tissues, which helps with rejuvenation. And then fibroblast growth factor obviously is good for fibroblast growth, which are the cells that make collagen. So all of these things that are released from the platelets help ultimately create collagen. Great. So how long does the process last, and how long does the product last when it's just the PRF? So because it's a liquid, the body, it doesn't stay in the body as long as something like Easy Gel, and we'll talk about that second. It's around a week or so that you get this recruitment of cellular activity and creation of collagen. And what's beautiful about PRF is that there's not the anticoagulant. So your body actually is what determines this clotting cascade, and the longevity of the PRF in your skin and your cellular activity is based on how quickly your body clots and repairs, versus in something that has an anticoagulant, the rate of activity is really only as long as the half-life of that anticoagulant, and we'll talk about that. So going back to PRF, the liquid's injected, you're a little bit swollen. We use this under the eyes, we use this in the nasolabial folds, we use this in the lips, we use this in the cheeks, and it's really for that skin integrity, the health, the collagen stimulation, but it does take time. And the reason why we've been really seeing incredible benefits is mostly in the younger population. So patients that want to start rejuvenating their skin, but don't necessarily want to use hyaluronic acid-based fillers and look puffy or fake. This is something that is better if it started earlier. It's natural. And yes, it takes time. It takes more treatments, but it's so beneficial. So now moving on to Easy Gel. Easy Gel is the same thing as PRF. It is the same concept. It's the same cellular activity. It's the same blood draw. However, there's several different key differences. So Easy Gel, after you spin the blood in the centrifuge at a different speed, you go through a variety of steps of heating and cooling. And the cooling is essentially what you're doing when you're making PRF, so that's the same. And the heating is what you're doing to essentially unwind, untangle, unfold the albumin in the blood. So with one of the blood collection tubes and how you spin it, you're going to isolate albumin. That's the most prevalent protein in our blood. And when we heat it, that protein unwinds. That is what is going to create the gel that we are going to inject. And what's beautiful about this, again, it's 100% natural. And with Easy Gel, you get actual clinical volume restoration, and you can see it. And those results will last you about 3 months. So it doesn't go away like PRF does, but they both are beneficial in different ways. So the Easy Gel is wonderful for areas under the eyes. I use this before I inject any other type of products like a hyaluronic acid filler. I always use Easy Gel first. It's phenomenal. We do a series of at least 3 about a month apart, and patients are loving it. It helps with skin health, and it also helps with volume restoration. You can also use PRF if patients have crepey skin that's thin, a lot of transverse horizontal lines underneath the eyes. You can use PRF as well in a liquid format. You can layer them, so this isn't just either or. Under the eyes, you can layer it, and you can go all the way up to the eyelid, the lower eyelid, with PRF and Easy Gel. That's another amazing benefit that it has versus a hyaluronic acid filler, which you cannot do that based on the anatomy. So Easy Gel can be injected under the eyes, it can be injected in the lips, it can be injected in the nasolabial folds, it can be blended with other products, other biostimulators, it can be layered with other products, and it's just beautiful. So what we recommend here is, first of all, we want everyone to know about this option. It does take longer, sometimes, especially with PRF, if you're not getting that immediate result, you have to plan for this. This isn't something that you want to do maybe if you want to change right before a wedding or an event. It takes longer. It takes more time. So we educate you. We plan for you. We help you get to your end result. But slow and steady always wins the race here. Always, always, always. It requires planning and patience. But at the end of the day, why would we not want to use our own body to rejuvenate ourselves versus something else? So it's really phenomenal. Our patients love it. Something I may have, or probably should have mentioned before this, is that PRF has been around for years and years and years. And it started with dentists, and they would use it for implants and renewal, dental rejuvenation. So it's been around for a long time. And the reason why we haven't been able to transfer it over into aesthetics is because in dentistry, you want that clot to form. So you want the platelets to go through that clotting cascade and form the physical clot. Whereas in aesthetics, you want that to take as long as possible. And that's why letting your body do this instead of having an anticoagulant that you're relying on. When you rely on the anticoagulant, it's only going to last as long as that anticoagulant. When you rely on your body, as in PRF and Easy Gel, it takes longer to clot, so you get more of that growth factor release, you get more of the cellular activity and more of the collagen stimulation. So we needed to figure out a way in aesthetics to prevent the clotting, because that's what they wanted in dentistry. So we finally gotten there. We know how to do it. We either use the anticoagulant as in PRP, or we use, empty glass tubes with a specific makeup, specific physical, attributes up to the tube, and a specific way of spinning, the angle, everything that's gone into the creation of this product. And it's beautiful. And so we finally have it. It's just the beginning with these products. I am so excited to offer them to all of you. Our team is really well-versed. They're trained. They know exactly how to do it. They know the science behind it. And now you do. So when you come in here and you see our providers, ask them about it. They love it. They want to do it. Everyone should have this. So we're excited. I hope this helped for both non-injectors and injectors and people in this field. I find when I talk to my patients, a lot of them are listening to this podcast, and I love that so much. And I'm trying to gear this to everyone while also having some of the science behind it. And now bringing in new guests, it's just going to change it even more. So we're excited. Thank you for listening or watching, and I will see you guys next time.